So today's lecture will be about local anesthetics. Local anesthetics. So when I say local anesthetic, what comes into the mind that we are talking about a drug which is acting locally. That means in a specific region. Okay, in a local region or in a specific area, right? And when I say anesthetic, that means a drug which is inducing anesthesia or kind of a numbness or loss of sensation. Loss of sensation. So when I say a drug is a local anesthetic, that means that drug is responsible for loss of sensation in a specific area or in a local region or in a restricted area. But when I use the term general anesthetic, that means this kind of a drug is responsible for inducing anesthesia or numbness or loss of sensation to the entire body. So here today's topic will be local anesthetics. These are the two categories of anesthesia. Today we will be learning about the local anesthetic mechanism of action. So on my right you are clearly seeing a diagram which shows how the sodium ions are entering and exiting or restricting or the entry is being restricted, and also the role of local anesthetic which will play with the entry of sodium ion, kind of barring the entry, that we learn in just few minutes. So local anesthetic is basically, there are various categories on which we can divide this drug. They have amide linkages and ester linkages. So the local anesthetic drugs are, their chemical entity is either made up of amides or esters, right? So how do we differentiate between them? There is a very easy trick to learn that when I say any kind of a drug is having two I's in them, okay, two I, alphabet I, that means that drug belongs to the category of amides, right? But when the drug is only having one I, that is belonging to the category of ester. So this is just my trick formula. This is not something which is a laid rule or something. So I'll just give you an example how it is. Like I say, lidocaine. Then I say prilocaine. Then mepivacaine. Okay. Ropivacaine. So these are bupivacaine. These are some examples of local anesthetic which is having the amide linkage or the amide bond, lidocaine, prilocaine, mepivacaine, ropivacaine and bupivacaine. So here you can see all these drugs are having two I in them. Okay, so this is just a trick to learn, not something which is a formula, any other thing. Then in esters, the classic examples of cocaine. Then we have Procaine. Then we have Tetracaine. And we have benzocaine. So these drugs are only having one I. So this is just an easy way to learn. So there are many drugs which are belonging to the local anesthetic category. They have different linkages, as in this is how we can differentiate on the basis of what kind of a bond they are having. This also further differentiates them on the basis of their mechanism of action, their solubilities and etc. that we'll be learning in a different chapter. So I'm just giving out names and an easy way how to learn them. My entire focus today will be on the mechanism of action of local anesthetic drugs. See what happens generally. I hope you have a clear idea of how a nerve conduction is happening. In nerve conduction, there is a potential called as threshold potential. I hope all of us are familiar with this threshold potential. And in case of the threshold potential, what is happening? The minimum potential required to create or initiate any kind of a response or to trigger a stimulus or to initiate a stimulus, that potential has to be crossed in order to show an onset of a stimulus or any impulse. But if that is not crossed, in that case the impulse dies and there is no activity noted, right? So this is the potential. So a minimum of threshold potential has to be reached in order for conduction of a stimulus. In simple words, I want to say that this potential has to be crossed. I will link a video here. I have deeply explained the stimulus onset, the depolarization stages, the action potential stages, the resting membrane potential in my previous videos. And in that case, I've also explained how the entry and exit of ions is actually creating a change in the ionic concentration, a change in the potential, which is leading to the change in the potential. Therefore, there is a generation of impulse or the impulse subsides. So again, let's focus on this. In case of local anesthetic, initially what is happening in this phase, that is the resting stage, and this one is the activation stage. Okay. In the resting stage, what happens? Sodium ions are not entering through the M gate channel. The M gates are closed and sodium ions are not entering, and this is how the resting stages is maintained. That means no impulse is being generated. But when the ion channel open, when the M gate opens, the sodium can easily enter the exoplasm. So this is the inside of the neuron and this is the extracellular spaces. When the sodium ion channel enter, it is already having the potassium ions here. When the sodium ions enter, there is an increase in the positive potential and the threshold potential is crossed and a stimulus is initiated, or I can say that you can feel the sensation of touch, temperature, pain and so on. Whatever be the reason of opening of this ion channel, the sodium ion enters, and there is an when there is an influx in the sodium ions, along with it carries the potential, because it is also carrying a positive charge with it. The positive potential increases inside the axon, inside the neuron, I can say in simple words, and the potential rises, right, when the sodium is influxed. But later on, the M gate closes and the sodium cannot enter. So this is again the repolarization, depolarization stages. So when the ion channels are opening, that means an impulse is initiated and that can progress, right? So if I say you can feel the pain, first of all, due to the ionic changes, you can feel the pain, and then that pain is traveling, right? So if this is a neuron, there is an impulse generation and this impulse is traveling and is now reaching to other neurons, and this is how the pain is traveling to the human brain. So the brain is actually recording if there is any kind of a pain impulse, right? Because it is easily moving across the axons. It is traveling across the axon due to the entry of the sodium ions. So this is the general phenomena of how the pain sensation is being felt. But when I use the term nociception, that is pain stimulus. So if I say due to local anesthetic, the nociception is blocked or the pain sensation is blocked. So how is that happening? Let's have a look here. The local anesthetics are actually alkaline in nature. The nature of local anesthetic is the local anesthetics are alkaline in nature. And when they are in their unionized form, right? And when they are in their unionized form, they can easily enter the exoplasm, they can easily enter the neuron, and here when they enter the neuron, due to the physiological pH, they are now ionized. They become ionized. Like let's say this. Now they have a positive charge. Initially they were unionized because they were in their alkaline form, and now when they cross this, the pH is now different here and then they become ionized. So when the local anesthetics are ionized here, they can easily bind to their receptor site, which is this If you can see, they can easily bind to the receptor site, and when they bind to the receptor site, they are ionized. Now there is when you learn about the solubility of drugs, the ionized drug is difficult to pass through. So now it is trapped here. They cannot escape this neuron, and this local anesthetic will now bind to its receptor site, and on binding to the receptor site, the ion channel which allows or which initially allowed the entry of the sodium will now be blocked. Right? Do you get it? Do you understand the mechanism of local anesthetic? So when the local anesthetics are entering, they become ionized and they attach to their receptor sites. On attaching to the respective receptor sites, they block the entry of sodium ions. So now when the sodium ions will not enter the neuron, the potential will now subside, and gradually it will also decrease beyond the threshold potential, and there will be no generation of impulse. So there will be no stimulus of pain. So the pain impulse will not be generated, and when the pain impulse will not be generated, it will not travel to the brain. So you will not feel the pain. That does not mean that there is no pain existing. The pain is there, but the impulse cannot be generated because the sodium ions are not able to enter. And when they are not able to enter, there is no threshold potential crossing. The stimulus is not strong enough to initiate the potential, and it subsides gradually. The pain is not felt and is not traveling also. So local anesthetics are blocking two kind of action. One, they are blocking the generation of impulse, and second, they are blocking the conduction of impulse. So they are blocking two things here. One is the generation of impulse. I am just writing it here. So local anesthetics have, now I will briefly write down the characteristics of local anesthetics. One, they have alkaline pH. They block the initiation of impulse, right? They also block the conduction of impulse. Initiation and conduction of impulse. Local anesthetics can have some kind of adverse reactions. They can report some kind of side effects like headache, dizziness. See, you have to be very responsible while administering a local anesthetic in case of a person suffering from heart diseases, right? So you do have to monitor their blood pressure before giving local anesthetic to a person suffering from a heart disorder, because it also causes myocardial depression. It can also cause respiratory depression. It can also cause vasodilation. So these are some of the, it can also cause CNS depression. It will obviously cause. So local anesthetics are mostly used in cases of dentistry. Like lidocaine is very common one. Okay, lidocaine has medium duration of action, so the action lasts longer. It is used in dentistry. These are some of the listed side effects. And local anesthetics can be administered via three ways. They can be administered by subcutaneous route. They can be administered by intrathecal route, that is to the spinal region. Okay, and it can also be given dermally we have discussed, right? Intradermal routes. So these are the three ways through which local anesthetic can be administered. Quickly revising this, sodium ions can easily enter through the M gate into the neurons, into the axoplasm, and when it enters the axoplasm, there is a disturbance in the ionic potential. The potential rises because the sodium is carrying a positive charge. That leads to that crosses the threshold potential, and that leads to generation of an impulse. But in the case and then When the sodium ion enters, again the ion channels are blocked and no more sodium entry is allowed. So then again it goes back to the repolarization stages. But in the case of administration of local anesthetics, when sodium is being administered, when local anesthetics are being administered, they are initially in their unionized alkaline form, but the moment they cross this axonal membrane, they cause the neuronal membranes, here they become ionized, and an ionized local anesthetic loses its solubility and it cannot cross back, so it is trapped inside here. So once it's trapped here, it binds to its local anesthetic LA receptor or the local anesthetic receptor. When it binds to the LA receptor, here what happens, the M gate channel closes and there is no entry of sodium. With the entry of sodium, we recorded a threshold potential. Without the entry of sodium, there is no crossing or a gradual decline in the threshold potential of whatever the sodium were left. And now no sodium entry is allowed. So gradually this potential declines, and this ionic potential declines, leading to finally barring entry of any kind of sodium ions, and no pain is being felt, or I would say no impulse generation. And when there is no impulse generation, local anesthetic is also prohibiting the conduction of the impulse. So impulse generation and conduction both are prohibited. So this is it from local anesthetic. In the future classes, we will be learning about more details about specific local anesthetic, their characteristic actions, how the amides are functioning, how the esters are functioning, right? So this was a brief lecture on mechanism of action of local anesthetic. In the coming lectures, we'll be discussing more topics. One thing you can do, you can drop your topics in the comment section so that I can take up new lectures based on that. So thank you. Do like, share and subscribe. Learn Medicine by Dr. Nikita, and also follow all our platforms. Happy learning.